Now is the time to answer some of your common health questions. Joining me is News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. So great to see you today.
You too.
RSV in children, we're talking about that right now. What's the best way to treat it? One of our viewer questions.
Yeah, I mean, RSV is a very, very common respiratory virus. We see it a lot, but fortunately, most children only develop cold symptoms with it. Every once in a while, though, we'll see something more serious, like bronchiolitis or pneumonia in the high-risk population. Now, who is that? Typically, it's going to be premature infants, any child less than 2 months old, a child with either heart or lung congenital disease, or anybody with an autoimmune or immune-weakening disease.
Sure.
Those are particular patients that we look for that are more at risk for more serious complications of the treatment. Like most viruses, there really isn't one. It's all supportive, so typically it's cool mist aerosols. In young children, we suction the secretions out of their nose, things like that, fever control. But if they get severe, or you see severe, or you hear severe wheezing or trouble breathing, bring them into us in the emergency department, and we'll start IV fluids. We can give medications through an aerosol. And then also IV steroids works very well. So keep an eye out for that because it is common this time of year.
All right, a twofold question here. What causes hand, foot, mouth disease? And then what can you do to ease that pain?
Yeah, that's also very common. And typically it's transmitted very easily from child to child through hand contamination. It's caused by a virus called Coxsackie virus, and that's very common. And we typically see it in children from 1 to about 5 years old, and no real surprise there because it's in daycare because they just tend to hold on to different toys and play with each other, and it's through hand contamination. So again, Coxsackie virus, common, no treatment, it is a virus, but it'll go away in about 3 to 5 days. The treatment for the pain, it's a little difficult because it's a nasty disease. You see blisters on the palms of their hands, their feet, and the most difficult to treat are the blisters like canker sores in the mouth. We can prescribe some numbing rinses. You can use Motrin, Tylenol. Cool liquids are effective. Ice cream has been shown to be helpful. But for the most part, it's just supportive care. So, you know what? Make sure you encourage your kids, no matter what age, to wash their hands frequently.
I'm glad we took Coxsackie virus and turned it into hand, foot, mouth. A little easier to say and remember. All right, if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com. Click on the health link. You'll scroll down, and then on the right-hand side, you're going to see a form to write your question. We look forward to getting those. Thanks so much, Dr. Soria, for coming in. We'll see you next week.